medical practitioner, and today, as I'm saying, that I'm sharing on the topic peripheral artery disease. Peripheral artery disease, what is it here? Peripheral artery disease is a common circulatory problem in which narrowed arteries reduce blood flow to your limbs. When I talk about your limbs, I'm talking about your leg and feet. In this condition, your legs don't receive enough blood flow to keep up with demand. When I talk about demand, I'm talking about walking and exercises. You know, when you're sitting down, you need different amount of, or different, the capacity is different. I mean, circulatory system is different when you are sitting or lying. But when you start walking, there's a higher demand of blood that should really flow in your whole body, in your legs, in your arms. So individuals with peripheral artery disease, that is, they have stiffened and narrowed arteries supplying their legs. The amount of blood getting to your leg is reduced, so it can't keep up with that demand. That is the walking or the exercise. This causes symptoms, most notably leg pain in the calf or behind your thigh when walking. We call this claudication. Claudication is just that describing the pain you experience in your calf and behind your thigh, telling you that you don't have enough blood supply in your leg. This is it here. When you're sitting, you feel relief, but when you start walking, you start to experience pain. All right. It is a common yet serious disease that doesn't show symptoms at early stages. It also restricts blood flow to the arm, kidney, stomach. As I'm saying, when you have that condition, it means that throughout the body, there must be narrowing of artery throughout the whole body. All right. Now, let me tell you some real facts about peripheral artery disease. The real facts. 1 in 3 diabetic patients over 50 years of age suffer from peripheral artery disease, the PAD. Smoking increases the likelihood of developing peripheral artery disease by 400%. You may say that you are not a primary smoker, but you may be a secondary smoker. You may be standing near somebody who smokes. So it's really very important that if someone is smoking, you don't stand nearby. Move from that area, because research has shown that it increases the likelihood of developing peripheral artery disease by 400%. Now listen, each year, approximately 150,000 lower limb amputation in the US alone can be contributed to peripheral artery disease. In the UK, there are also thousands as well. So amputation around the world, it can be because of peripheral artery disease. You know, within 2 to 4 years of the first amputation, 1/3 of all the peripheral artery disease patients will lose the other limb. Will lose it. Now, I want to emphasize on operation. So when someone first time got a peripheral artery disease, so he goes to the hospital, they amputate the first leg. So he feels, okay, this is a kind of solution, but it's a management, it's a temporary solution, because within 2-3 years, the other leg will be affected, and they will also go ahead to amputate the other leg. So what will happen? That person's life, I would say, literally has come to an end. The person will be without limbs, cannot walk, will just remain in a wheelchair. About 20 to 50% of people with peripheral artery disease, I tell you, they show no symptoms at all. Peripheral artery disease affects 12 to 14% of the world population. So it means millions and millions of people have this problem. It's a common problem. It increases your risk of heart conditions or heart diseases, heart failure, sudden cardiac death, or we can call it cardiac arrest, When you talk about cardiac arrest, it means the electrical part of the heart can't stop. And so the heart stops beating and it's over. So such people may die in their sleep, which is really sad indeed. It happens all the time. It happens all the time. But now, you see, let's come to the causes. What actually leads to or brings about peripheral artery disease? You see, the most common cause, is commonly caused by atherosclerosis. Atherosclerosis is simply a buildup of plaque deposited in the walls of the arteries. So the arteries then get narrowed and then stiff. So the amount of blood that should flow through the body can be reduced. It means the capacity of the circulation capacity can then be reduced. But these plaques are made up of excess cholesterol, fatty substance, calcium, and other waste that can cause, actually can come together to fill in the cracks in the walls of the arteries. Every artery or every blood vessel has their walls. But you know what? The whole thing is that doesn't mean that the cholesterol is bad. No, not at all. Cholesterol is a natural substance and that has a role to play in the human body. Our liver produces 85% of the cholesterol needs. They have role, they have functions. And one of the functions is to fill in the cracks in the arteries. If there is a damage or there's a tear in the walls of the arteries. But what we should blame is how possible there is, what causes the tear in the arteries. That's what we should blame. We shouldn't blame the cholesterol. No way. You see, if you see fire trucks or, a fire truck moving in the city, going somewhere because there is a house or somewhere is on fire. So they are going to do their work. If you see a police van with a siren, it means maybe there's an armed robbery or some bank robbery somewhere. It doesn't mean that the police are doing bad job. They are doing their job. It's the same thing when you see the low density lipoprotein. That's the so-called bad cholesterol swimming in the blood, moving somewhere. It means that something is wrong somewhere. So the brain will actually prepare everything, combined cholesterol with calcium, and combine that with other waste, fatty substances in the blood, because it's like a filler. It's like you have cracks in the walls in your house, so you need a filler. So it's the same thing in the human body. When there are cracks in the walls of the arteries, you need a filler. So if you don't fill in the cracks and there's a damage, that individual may bleed, internal bleeding, may bleed to death. So this is a kind of survival mechanism, it's a natural mechanism. And so you wouldn't blame the so-called bad cholesterol. There's nothing bad in a human body, nothing bad. Everything has a role to play. I want you to know. So no one should tell you that there's a kind of bad cholesterol and the good ones. God wouldn't create some good ones and bad ones in the human body. It would never happen. So I hope we understand now that the role of the so-called bad cholesterol, that we call the LDL, low density lipoprotein. Now, let's move on. So it's very, very clear what happens. Now, if there's a plaque or some plaque in the artery wall, if these plaque inflames or is brittle, it may rupture, and then it can trigger a blood clot formation. And so when it triggers this clot, it is a clot which is unwanted clot. We have the body. If the body naturally forms clot, it is all right. It repairs, it's without any consequences. But if clots like this form, like in this way, it forms, it's very dangerous. So a clot can further narrow the artery and completely block it. If it is going towards the brain, it goes through the carotid artery. There's an artery which feeds or supplies blood to the brain. It causes stroke. If it is supplying blood to your heart, it causes heart attack. And remember, when the individual has heart attack, it can trigger sudden cardiac arrest, or we call it sudden cardiac death. All right. So you can see through peripheral artery disease, we can see other consequences, other real complications, very serious ones. So now let's come to the symptoms. How would you identify that you have peripheral artery disease? Now, before I put the symptoms on the platform, let me give you our telephone number. If you need help with any cleaning of your arteries, which is the key thing to reverse this problem, reverse cardiovascular diseases, heart attacks, strokes, and any problems related to sudden cardiac death, then give us a call. Calling outside the UK is +44 738 464 7300. Calling within the UK is 0738 464 7300. Second number here is +44 745 988 9152. Calling within the UK is 0745 988 9152. Give us a call and your life will never be the same. Now, let's have a look here. The symptoms of PAD, peripheral artery disease. Now, let's come here. Now, many people with peripheral artery disease have no symptoms at all. There's no early symptoms at all. So it means the problem will keep building up. Your arteries will keep building up until it gets to, let's say, about 80% build up in your arteries. 80% before you start to feel the symptoms. So you see, if it is 50% filled up in your artery, I mean your artery, there's plugging in your arteries. 50%, no symptoms will show. 60%, no symptoms will show. 70%, no symptoms will show. But when it's about 80-85%, that's the time that you will see the symptoms appearing. So that's why I'm saying that symptoms of diseases mean that the disease has gone far, has developed, has gone really, really far. So we shouldn't wait until symptoms of diseases start. That's the meaning of it here. Now, if the individual, I would say, is lucky here, then there will be mild symptom, mild one. Now, some people may have leg pain when walking, only when walking. So when they are sitting, they don't feel any pain. But when they start walking, they start to feel pain, especially in the calf and or behind their thigh. Now, we call that claudication. Now, claudication symptoms include muscle pain or cramping in the leg, which actually is triggered by activity like walking or exercise, and it disappears after a few minutes of rest. So remember that. So when you have the pain and you sit down for a while, then of course you are relieved of the pain. But when you start walking or doing any exercise, running, then of course you start to feel the pain. Remember, put all the symptoms together, at least some symptoms together, then you will then figure out that it's really peripheral artery disease. Now, the location of the pain depends actually on the location of the clogged or narrowed artery. So if you feel it a particular place, that is where the clog could be. It means that area is narrowed or there's a clog. Right. Now, calf pain is the most common actually symptom, the calf pain. So take note of that, your calf. Now, the next symptom is painful cramping in one or both of your hips, your thigh, and of course, calf muscles. Now, if you are not careful, it will be diagnosed as arthritis, and you'll be given painkillers. You'll be given painkillers. So when you're climbing stairs or walking, you may feel pain in your hips. And if you're not careful, you may consider it to be arthritis, but it's not arthritis at all. When we move on, we see that the leg can be numb. So numbness and heaviness and weakness in the leg. And then that individual may feel that there's a coldness in the lower limb, coldness in the lower limb or foot, especially when compared with the other side. So when one side of your body is cold, especially the leg is cold, and the other one is warm, remember, it's typical of peripheral artery disease. Now, other symptom is soreness on the toes. If you have sores on the toes or feet or leg, that won't heal. It won't heal. It refusing to heal. Then, of course, you have to know it could be peripheral artery disease because you don't have enough blood supply in that leg. You know, blood is a cooler. So if there's any burning sensation, it cools the place. And blood is practically or naturally is the life of the flesh. Now, hair loss or slower hair growth on the feet or leg is also another symptom. So if that area you are losing hair on your leg, then of course you know that there's something wrong. You don't have enough blood flowing in your leg, so you're losing hair. That area, that leg area, the same area that you're losing hair could be shiny. You see that the skin is shiny compared with the other ones. Now, at some point, there won't be any pulse at all in your leg or weak pulse in your leg or feet. Now, a very, very important symptom here for the men is erectile dysfunction. And then, of course, very sad one, manhood, shrinking of the manhood. So if you are a man and your manhood is shrinking, is becoming smaller, you have to know that you don't have enough blood supply to your pelvic area for your manhood to really enjoy that nutrient and oxygen for that muscle. So it starts shrinking. So when you see these symptoms, you have to know it's quite serious symptom. You know that it's a peripheral artery disease that has developed. It's already developed. It's not on the way. It's developed. Now, what are the risks? Who actually gets peripheral artery disease? Diabetic patients. Diabetes. Diabetes causes constant inflammation. Constant inflammation in the body. And as I told you, inflammation is the basis of all diseases. So if someone has diabetes, diabetes is a single disease that actually brings all other diseases in the human body. And the cholesterol can increase because of the inflammatory condition. Cholesterol increases because of inflammatory condition. So if you want your cholesterol levels to come down, reduce inflammation in your body. If you do that, you will have the right range of cholesterol. It doesn't make sense at all to take cholesterol medication that you are reducing cholesterol levels when you have constant inflammation. That's why many diabetic patients are on cholesterol medication, because they have constant inflammatory condition in their body. Obesity, when you have unnatural weight, of course, can also cause constant inflammatory condition and plugging of the arteries. And of course, weak heart. High blood pressure. High blood pressure is not a disease. It's an indicator that something is wrong in your body. So find out, trace, and track the disease. Find out what is causing your high blood pressure. But it is, in a way, it is a risk factor for peripheral artery disease. Smoking. We've mentioned that. If you're a secondary smoker or primary smoker, you are at risk. In fact, research has shown that it's a 400% is really very serious. Now, those that have a kidney disease, if that individual has a kidney disease, is also a risk factor. And the people over the age of 50 years old and more, they run that risk, because at that age, most people have no idea that their arteries are plugging. Artery plugging now these days happens even to children because of the kind of food they eat. But arteries plugging with age, it happens naturally too, but it should happen at slower rate. So that when you're 100 years old, your arteries may not be too filled. It may be filled, but not too much. But our lifestyle, especially the food and inflammatory condition and lack of nutrients and poor circulation, causes this atherosclerosis, the plugging of the arteries. A family history of peripheral artery disease or stroke, but family history, listeners, is only 35%. So it means that it all depends on your lifestyle. If your lifestyle is okay, you wouldn't have any problem at all. Genetics is only loaded gun. It's a loaded gun. Only your lifestyle will actually pull the trigger. If your lifestyle is good, the trigger will never be pulled. Now, let's have a look at the complications. What complications can peripheral artery disease actually bring? The complications are the following here. Critical limb ischemia. Critical limb ischemia means that the condition begins as an open sore that doesn't heal, or an injury, or infection of the feet or legs. So you will have a critical limb ischemia. The sore on your leg will never heal. And then through that, it can lead to what? Amputation. It can lead also to what they call gangrene. It's a tissue death. That is the cause of that. And through this, the leg can be amputated. That is through gangrene. Another complication is stroke or heart attack, or what they call the sudden cardiac arrest, which leads to sudden cardiac death. Just 2 days ago, a young footballer fell, on the feet, just fell suddenly, went into sort of, fainted. He was unconscious. He had to be resuscitated. And they realized that there is all this sudden, that's a cardiac arrest, right? And now this footballer possibly will never be able to continue with his career. What am I saying? If we don't pay attention to ourselves, to our health, it can stop you from all your plans, not only your career, but any plan that you have in the world. Ill health can stop everything. And you are the only one responsible to take care of your health. If you don't do it, no one is going to come into your life to do it for you. I thank you very much for listening. Please visit us on YouTube. Visit us. Put in Dr. James. That's natural link. Please subscribe and press the like button and support. Share the link. Be a blessing to someone, and that God will also bless you. Because as you push someone upward or to the top, you also go along. You push yourself. What am I saying? There will be a blessings on your life. Thank you very much for listening to me. And look forward to seeing you. Not seeing you, but having a wonderful encounter with you this coming, the coming period or season. All right. That was Thursday. God bless you. And I'll see you, or I will have the encounter very, very soon.